Good morning. Today we're discussing hypertension, the silent killer that affects nearly half of U.S. adults. Most don't know they have it until complications develop: heart attacks, strokes, kidney disease. But here's the good news. Hypertension is treatable, and the 2025 ACC/HA guidelines give us new tools to manage it better than ever. Let's start with the basics. Hypertension affects nearly half of all adults in the United States, yet most don't know they have it. That's why we call it the silent killer. It causes damage silently, without warning signs, until complications develop. These complications include heart attack, heart failure, stroke, kidney disease, and even cognitive decline. Understanding hypertension is literally a matter of life and death. Let's start with the basics. Blood pressure is simply the force of blood pushing against the walls of your arteries. We measure two numbers: systolic, which is the pressure when the heart contracts and beats, and diastolic, the pressure when the heart relaxes between beats. Think of your heart as a pump and your arteries as pipes. When pressure stays high, those pipes become damaged over time. The 2025 ACC/HA guidelines maintain the same blood pressure categories we've used since 2017, but with important refinements in how we apply them. Normal blood pressure is below 120/80. Elevated blood pressure is systolic between 120 and 129, with diastolic below 80. Stage 1 hypertension is systolic 130 to 139 or diastolic 80 to 89. Stage 2 hypertension is systolic 140 or higher or diastolic 90 or higher. Notice that these thresholds haven't changed. What's new is our risk-based approach to treatment, which we'll discuss shortly. Hypertension falls into two main categories. Essential or primary hypertension accounts for 90 to 95% of cases. There's no single identifiable cause. Instead, multiple factors like genetics, age, lifestyle, and environment contribute over years. Secondary hypertension makes up the remaining 5 to 10%, caused by underlying conditions like kidney disease, sleep apnea, thyroid problems, or medications. And here's a critical 2025 update. Screen all patients with resistant hypertension for hyperaldosteronism, regardless of their potassium levels. To understand hypertension, we need to understand how the body normally regulates blood pressure. For key mechanisms work together. Baroreceptors sense pressure changes in blood vessels. The sympathetic nervous system regulates vessel constriction and dilation. The kidneys control blood volume through fluid balance. And the renin-angiotensin system creates a hormonal cascade affecting both vessel tone and fluid retention. When any of these systems malfunction, blood pressure rises. Third, renal denervation is now an FDA-approved option for resistant hypertension after multidisciplinary evaluation, offering an alternative to lifelong medication for carefully selected patients.